There is a new procedure and program at Rochester Regional Health that helps breast cancer patients with the emotional impact of surgery by hiding the visible signs of it. We're joined by Dr. Laura Medeiros, medical director at the Rochester Regional Health Breast Center, I should say. Thank you for joining us. This is really interesting. It's called hidden scar surgery, right?
So in medical circles, we call it oncoplastics, but hidden scar surgery is something that I think most people can relate to. And it really has to do with trying to go into the next step of breast cancer survivorship. So as you know, people now survive breast cancer, which is great. There was a time when really getting that diagnosis was a death sentence. Now, because of better screening and better techniques, we now manage to get women past breast cancer and into the rest of their lives. And so now we're starting to wonder what we can do to kind of minimize the impact of that disease on them long term.
We know the term mastectomy and lumpectomy, and you hear those terms and you think, all right, well, this is progress towards making people better, but yikes. Yikes.
Yeah, so people underestimate, I think. The most common thing I see when women come in with breast cancer diagnosis is just, get it off, get it out, get me out of here, I don't care what it's going to look like. And it's a bit of a process to kind of explain to people, yeah, for sure, number one goal is to get this breast cancer dealt with and dealt with in a safe oncological manner. But secondarily, part of my responsibility is to make sure that you're going to be okay down the road. And while initially people think about this as just cosmetics, it's really more than that. It's really about how you get dressed in the morning and how you interact with your kids, and if you're comfortable swimming, and if you're comfortable going out with your husband and being in a certain garment, and hiding those kinds of things in a way that makes the surgery a little bit more, I guess, palatable for a lot of people really is important.
Yeah, and when you think about that, like you said, you're responsible not just for saving lives, but also quality of life. That's it's quite a we might have been a real tall task for doctors years ago, right? Yeah, and now it's not so hard with the new technology and the new ways of doing things.
And it's really something that I think we're starting to pay more attention to. So it's really not so much only about getting somebody through the cancer piece of it, but really about getting that emotional impact under control. So hiding these scars, either for lumpectomy or for mastectomy, really does impact women in a positive way.
So it's actually different the procedure that you do. What's the difference?
Some of the things for lumpectomy, for example, some women who have come to me who had been recommended to have mastectomy, for example, really didn't want to have a mastectomy, but had large tumors or tumors that didn't seem to be amenable to traditional lumpectomies. Sometimes we can combine these with other techniques, such as reductions. So somebody who's a little heavier, has a large tumor, we can manage to get this out, do a breast reduction at the same time, and really get them past that mastectomy piece of it. So the importance of that from a functional standpoint is you save the nipple, you save function, you save sensation, which for a lot of women really impacts quality of life. Same thing for mastectomies. So we now have newer techniques that allow us to do mastectomies while saving the nipple. So really, we remove the breast tissue, reconstruct underneath that, and really give somebody a good outcome.
Wow, it's incredible. And you're right, it's not just about appearance, it's about so much more than that. It's amazing. And again, it's called Hidden Scar, the first center in Western New York to be certified in this surgery. It's amazing. Awesome.
Yeah, it's great.
Thank you, doctor.
Yeah, thank you.
Good to have you.
My goodness. We're so lucky to have all this great resources here, aren't we?